We'll do wait about 45 more seconds and then I'll be rolling. 7. So
Once you verify, they can see your.
good evening, most wonderful clients in the whole world. I hope you guys are doing well. Can you see a welcome to Medicare screen? Just nod your head. Yes, good. Okay. If there's something, if you're not able to see, just unmute yourself. Otherwise, please keep yourself muted. Not that I love hearing myself talk, but I need to be able to hear so I can present to you all. Um, it's great to meet you here in this space. For those of you who are tuning in who do not know me, my name is Tammy Akers. I am an Medicare insurance broker in Midlothian, and I focus on all things related to Medicare. So, I want to do these educational seminars to help you guys navigate the things that brokers have been cut out of. There's no longer any kind of compensation for us. So when you have four, five, 600 clients, you'd have to hire people to help you do these kind of things, and we don't have the money coming in to do that. So my solution is to teach you how to do this yourselves because they think you should be able to do it on your own. And the great thing is it's not that difficult. It can seem more daunting than it is. But so I'm going to show you how to shop your own drug plan. I'm going to do a Q&A at the end of the call, of the end of the presentation. So if you could save your questions till then, that would be great if you can jot them down or something. And then I'm going to post this and email this video by Wednesday so you can watch it again. All right. Um, so if you are on a Medicare Advantage plan, this is not for you. Uh, this is for people who have a supplement and a drug card. If you have a Medicare Advantage plan and you've tuned in, unless you intend to talk with me about trying to move from Medicare Advantage to Medicare Supplement, which is a totally different leg of Medicare coverage. Unless you're going to seek to move away from Medicare Advantage, this is not going to do you any good because you already have prescription drug coverage most likely under your Advantage plan. And if you were to enroll in a prescription drug plan, it will automatically disenroll you from your Medicare Advantage plan. So if you're in any way confused, please reach out to me. But I just want to make sure the audience is my intended audience, and or if you're just curious about Medicare, well, welcome. So, um, so there's a lot of this is a very tumultuous open enrollment for the fact that there is no longer broker help for prescription drug plans. Substantially, there's not. And the Medicare Advantage plans have really narrowed, and people are seeking to move around. So it's been a very head-spinning past couple of weeks, but I'm delighted to be here with you and help you in any way that I can. Just because I can't enroll any longer doesn't mean I'm not here to help guide you either through text, email, or phone call. All right, so 2026 uh, prescription drug plans is down to 9 plans in the market. Um, 2 years ago, there were 24. Last year, there were, well, for 2025, there are 15. And for next year, there are only 9 plans in the market. The reason Carrie Anthem has left the market entirely, Cigna has left the market entirely, and the reasons is it's about profitability. There were some limits placed in the Inflation Reduction Act that was passed a couple years ago, and it made these drug companies have to bear more of the costs. And so they're saying, we're done. We're not making enough profit to make it worth our while. So it's good for some people on expensive medications, but there's always a give and take when something like that happens. So we're down to 9 plans. 3 of those plans are zero premium plans, which is really a surprise and is good. It's WellCare, Value Script, Humana, Value, and Humana Basic. So I'll get to those in just a minute. I'll show you all the ones that are available. The maximum out of pocket you can spend on copays and coinsurance for 2025 is $2,000. For reference, in 2024, it was $8,000. This coming year, it will be 2,100. So $2,100 in 2026 is your maximum out of pocket, premium not included, your maximum out of pocket on copays and coinsurance for your medications. The deductible is capped at $615. So most of these plans, if it's preferred generics or generics, minimal to no copays, minimal to no. Once you hit a brand name medication, like I say, the ones that they on TV they do commercials for and they dance and all that stuff, it makes you look like you want to be on those drugs and have those diseases. All right. So those are the ones where you're going to have a $615 deductible that you will have to navigate. So that's the maximum there. So in order to shop your drug plan, we want to go to Medicare.gov. Medicare.gov, you'll see it up here. Okay. Um, if you already have a Medicare.gov account, this is different than SSA.gov. If you don't have one, I suggest you create one. All you need is your Medicare card, your red, white, and blue card to create it, because it will populate with medications that you've been getting filled. So you can edit that list. You can, in any way you need to, add, subtract, get rid of, whatever. So you put that there, and that way it'll already populate for you. I don't have the capability to show you what that looks like here because I'm just a baby. I'm just 62, so I don't have a Medicare.gov account yet, and I can't create one. So you can do it that way or do it this way. And it's the same principles as you go, whether you log in and do it yourself with your own account rather, or whether you do it from this main tab right here at Medicare.gov. So, health and drug plans. That's our first tab. We're going to hit health and drug plans. We're going to go over here to the first column, find and compare. Find health and drug plans. Okay. Continue without logging in. So that's what I'm doing. So the coverage is for 2026. So let's do a zip code 23113. All right, so my part of 23113 is Chesterfield County. Be careful to choose the right county or city. Believe me, believe it or not, it really matters. And then hit continue. Next, it says select the type of plan you want. Do not select the first box or the third box. You want a Medicare drug plan. So the middle dot is what we're doing. Excuse me. And then we hit find plans. Next question, do you get help with your Medicare health or drug costs? If you're on Medicaid or have supplement, usually if you're on a supplement, there's no Medicaid involvement because you're not allowed most of the time. Or if you get any kind of extra help with your drug costs due to income constraints, you will check one of those boxes, but most everyone will choose the last one. I don't get help from any of these programs. So then you hit continue. Do you want to see your drug costs when you compare plans? I think this is a funny question because, of course, you do. So we'll go yes, great. And it says to see drug costs, get ready to enter your prescription drug information. So make sure you have those bottles out in front of you or a list. We're going to get some specific information to get the best pricing possible. So we hit next. And here we are already. All right. So we're at add prescription drug. So let's say I'm on the most common medication I price is atorvastatin. So I'll say I'm on atorvastatin. I'm not on the amlodipine atorvastatin. I'm just on the regular atorvastatin. So if you'll notice when I punched the first couple of letters, it just populated and gave me some choices. So add drug. Okay. Well, I happen to be on 40 milligrams, so that's okay. And I don't get 30 when I get it refilled. I get 90, and I get 90 every 3 months. So my doctor has me get it filled every 90 days. So I get 90 pills every 3 months. And I'm going to add this to my drug list. All right. Next, I'm going to add another drug. So what am I on to? I'm on Montelukast stuff. That's singular. So I want to add that. Yes, I take 10 milligrams and I get 30 every month. So I'm just going to add that to my list. Add another medication. So let's do lisinopril. I happen to be on the hydrochlorothiazide one, so I don't want to pick this one. I'm going to go down and pick this one, HCl lisinopril. And I'm going to add this drug. I'm not on 20-12.5. Let's say I'm on 10-12.5. So I'm going to click that. And I get 90 of those every 3 months. All right. Well, those are my three meds. So I'm going to now say I'm done adding these drugs. So I hit done adding drugs. Now I'm going to select my preferred pharmacies. The CVS is CVS. Don't get too hung up on the one specific address because all the CVSs will price the same. But I want to price mail order CVS, Midlothian Apothecary. I get up to five, okay? Um, uh, I want to do, let's say I like Kroger, and I'm going to do Walmart. So I've got five pharmacies that I'm comparing. Doesn't mean that's necessarily where you want to go, but some pharmacy costs can be lower because they're preferred, and it might be in your best interest to switch pharmacies for a better price. So we like to compare. So in the bottom right-hand corner, continue to view plans. It is automatically going to populate lowest overall cost to highest overall cost. You'll see up here on the left, it says you're viewing 2026 plans. All right. The first plan to come up, this is really nice. There's no premium on this plan. It's a 3.5 star plan, which means it functions pretty well. I don't think there are any plans that are more than 3.5 stars. That's about the quality of the customer service, how many people come and go from the plan, how it's functioning overall. Um, it's telling me if I do it mail order, I'm not going to pay any copays for my medications or at the pharmacy. I'm not going to pay. So I got to see, I have a $615 deductible. So the blue button here is plan details. It tells me all three of my medications are covered, right? No premium, drug deductible 615. I'm going to look again to make sure I put my medications in correctly, and I did. And you will see that CVS and Kroger and mail order are all preferred. Well, sometimes the preferred pharmacies might not have the best pricing, so let me scroll down here and see. Okay, this is a great example. I'm glad this happened. Okay, first column, if I go to CVS, I'm not paying any copays for these medications because they're all preferred generics. If I go to the good old Midlothian Apothecary, I'm going to pay $84.20 for these same medications just by going to the apothecary, and that's for the year. Okay? That's not monthly, that's a year. Walmart, I'm going to avoid like the plague. Look at this, $433 for the year if I get these prescriptions filled at Walmart. Kroger zero, mail order pharmacy zero. Okay, so we've eliminated Walmart and probably Midlothian Apothecary. Well, that's okay. I already go to CVS anyway, so I like that. All right. Gives you a little bit more information. Drug premium plus cost right there. You won't meet your deductible. This is because this tells me what I would pay every time I got these medications filled, assuming I got them filled exactly as I put them in. And then I could open this up if I want to see more detail about the costs. And then I'm going to go down here to view more drug coverage. I'm going to open this. This is telling me that on this plan, preferred generics are zero copay. So all of my medications are preferred. If I get a generic, it's $3 per 30-day refill. Okay. Preferred brand, here comes the deductible. Deductible $615. And I'm responsible for 25% of the cost of that medication. And my maximum out of pocket will be $2,100. Okay. So it tells me all three of my meds are tier one. These medications are re-tiered every year, and the tiers vary per plan. So they get the prerogative of going through that and reclassifying these medications, and then Medicare has to approve these plans. Okay. All right. What I do now is I go over here to this green enroll button. I said, yeah, there's no point in me doing anything else. I'm going to enroll in this plan. I hit enroll, join plan, put in my Medicare number. I've read this stuff, which I'm actually not ever going to read ever, but it's Privacy Act stuff. But I'll say I've read it and hit next. And and then it just goes on from there, your name, your address, and that sort of thing. Okay. So let's go back. Let me show you the other plans and what they would have cost me. So that's the first one, Medicare Value Script. Humana Value RX plan. I could do that one too. The premium zero, drug deductible 601. So choosing either one of the top two would have been fine with this one. All right, this shows you why we have to shop these. So Humanic Basic Plan. Oh, wonderful. The premium on that one is zero as well. But look how much those medications are going to cost me if I'm on Humana Basic and I don't shop my plan, I will spend $647 on those medications that up at the other two plans I'm spending nothing. Okay? So let's see what the deal is here. Uh Look at this. Same medications at CVS under this plan, 647, 647, 647 across the board. I have just illustrated the importance of shopping your plan and not being fixated on these low monthly premium, the zero monthly premium or the low monthly premium. That's only a part of the story. Okay, so all right, so back out here. So these top two plans, they're both just fine. Humana Basic, that one, if I stayed on the WellCare Classic, I would spend 725. If I was on the Humana Premier plan and didn't shop it, I'd pay 87.60 a month, and then I would pay, well, and then the medications would be no cost because I'm paying so much every month just to have the plan. All right. So I will pay 87.60. I'll pay $1,051 instead of paying zero if I had shopped my plan. And then AARP 1274, another AARP 1389, and the Silver Script. If you're on a Silver Script, please shop your plan. I mean, that premium's gone from like $28 and change to 78.20. I bet you 98% of you all can find a plan that's better than this one if you're on that. And HealthSpring, I have no experience with them, but look at that premium, $133.80. All right. So I hope this gives you an overall view of how they already suggest for you which one they think is the best match or cost-wise. Either one of these two would be fine. I'm sure you noticed the $14 difference in the deductible. Um, I, if, maybe if I had to do over again at the beginning, I'd probably say, well, I'll save potentially the 14 bucks. I'll do the Humana value. But either one of these two would be fine. But most all the time, it's the first one up. Okay? So I'm going back here and I'm going to do some different medications. So I'm going to remove this drug and I'll remove this one. So let's say I'm still on hydrochlorothiazide, lisinopril, but I'm also taking Eliquis. Eliquis is a blood thinner. That's what I take, and that's how often I get it. It is prescribed to me. Let's say I am on Repatha. We'll add that. Yes, that's what I do. I do the auto injector. I do the pins sold in a pack of two, and I get one every month. Add that one. Um, let's see. What else can I add here? Um, let's see. Gosh, I know all these medications. I'm trying to think of something okay, so metoprolol. All right, got to be careful right here because there's one variance that's a tartrate and the other one's a succinate. I need to make sure I choose the right one. So I'm on succinate. I'm going to add this medication. I take the 50 and I get 180 of these every 3 months. Add to my drug list. All right, so now I've thrown in some brand name medications. So here we go. Done adding medications. Same pharmacies. I will get rid of mail order for a minute. All right, we'll throw in Walgreens. Okay. Continue to view plans. Okay, the Humana Value Plan is the one that's most cost effective for me. The next one is Humana Premier. Okay, this one has no premium. This one has 87.60. But what we want to be concerned about, guys, is the overall cost, 1715 versus 1771. These are the total of your premiums and your copays and coinsurance, okay? So don't be hung up on this unless you say, well, I'm pretty sure in the next month I'm going off of this expensive medication. Well, you can nuance it in whatever way you want if you really think that's going to matter. Because I will have people ask me, Tammy, can you price that without this expensive medication? Because I'm not sure how much longer I'll be on it. And then they choose from there. Okay. So let's do the Humana Value Plan. No premium. The medications will cost me $17.51. So let's find out what's so expensive. Well, first of all, the best pharmacy priced this time, Walmart, which was the big loser last time, is the winner, but not by much. And Walgreens is the same. The price difference here is kind of negligible, just a few dollars if you don't want to have to move your prescriptions. All right. So let's go and see what's well, okay, right here it tells me the pricey medication is the Repatha. All right. So usually those injector type medications are expensive. Medicare does not cover any of the injectables for weight management, but they do cover if it's for diabetes, like the Ozempic. And there's buzz that they're going to change that, but they have not changed it yet. So if it's not for a heart condition or diabetes, the injectables, Mounjaro, Wegovy, Ozempic, they're not going to be covered by Medicare. Okay. Um, so the Eliquis is a little pricey too. So that's how we're getting to this number. So let's go down and it's telling me I'm going to meet my deductible in January of 2026. All right. So let's look at what Walmart's doing here. Walmart says, Tammy, when you get all these medications filled and you pick them up in January, you have to pay $596.41. It's because I have the front end deductible, because Repatha and Eliquis are both brand name medications. When I go back in February, I'll pay $159.90, and that's what I'll pay through August. And then in September, October, November, December, I'm clear of copays. Now, this is where it's not going to make any sense to you, me, or the people who wrote these plans right here. I have met my maximum out of pocket and I've only spent 1715. Tammy, I thought you said the maximum out of pocket is 2100. It is. And when you try to get an explanation as to why sometimes you don't spend that much, but you still reach the maximum out of pocket, the answer is so bizarre and crazy about retail costs and this and that that nobody can even explain it, much less follow it. But good for you. You got there at 1715 instead of the max of 2100. They consider you to be at the top. All right. So that's really great. So that's why in September, October, November, December, it drops to zero because they're satisfied that I have met my maximum out of pocket. So Walmart tells me what they are before that. This tab doesn't really help me that much, but you might help you. It tells you the retail cost before the deductible, after deductible. But I'm more concerned about this chart up here that tells me more. Okay, star ratings on this one, 3 stars, more drug coverage. Preferred generics, 0. Generics, 0. All right. Um, Eliquis, brand name drug. Repatha, brand name drug. So it's a 3. All right. So that's why they're pricey. Okay. Let's go back out to search results. Let's say I'm on these medications and I don't shop my drug plan and I have AARP RX preferred. I'm going to pay $100.80 a month for a total of $2,400. Tammy, that's more than 2,100. Right, because it's the drug and the premium cost. This is the number we're fixated on here, okay? Not not how low the premium is. All right. And remember, Medicare does you a solid by populating this in the order that they believe that they are stating is most cost effective based on the medications you put in. And then HealthSpring, um, and then look at this one, WellCare Value Script, $9,460. Well, that tells me that WellCare Value Script is not covering one of these medications. So let me show you what that will look like. So you hit plan details. The medications will cost $9,460. I bet it's Repatha. Okay. Yep. Repatha is not covered under this plan. If it's not covered, it's not subject to the $2,100 out of pocket. If you see this yellowish, oranges not covered, keep your eye out for that because that's a problem, right? Um, so it's 9,000. So that drug, if I get it, if I'm paying out of pocket, that's how much I'll pay for it. Um, if your drug is, again, if your medication is not on the formulary, it is not subject to the $2,100. Let's say you get prescribed something that's not on any formulary, then you can do a formulary exception, ask the the insurance company to cover that for you. Many times that's successful if your doctor can't come up with something that's um, comparable, especially if that medication is covered by another carrier. It just doesn't have to be happen to be on this one. I kind of doubt you'd get it approved in this situation, but Um, that's called a formulary exception, and your doctor's office can help you do that. And if you need a formulary exception, call me and say, Tammy, there's this medication is not on this on the formulary. There's nothing comparable my doctor can find, and I'll walk you through how to do that. All right. So that's really neat that that came up because I wanted y'all to see what it looked like when something is not covered. Okay. So that poor person that just said, "Oh, my WellCare value script is 0. I'm just going to keep it." Well, guess what? They can't take Repatha, but if they moved to Humana Value, they could afford it most likely. Okay. Um, so I am going to hush up for a second and see if anybody wants to ask me anything. If you do, unmute yourself.
Tammy, I have a question.
Hi, Penny.
Hi. Okay, so um, we have our regular meds that we fill on a monthly or 90-day basis.
Hmm.
How do we plan for or anticipate unexpected drug costs? Like we get sick, we need an antibiotic, or we need a steroid, or like I just had an asthma inflammation and I had to go on prednisone. So how do we account for things we don't expect on a regular basis?
Great, great question, Penny. All of these plans come with a very lengthy formulary that is pages of medications. They are required to have two medications in every major category. So most likely you will be on something that's covered, most likely. If you're not, then we would have to do the exception thing. But all of these plans have antibiotics. All of them have pain medicine. All of them, we're just pricing them based on what we know that you take. So every year they have to submit their plans to Medicare, the Center for Medicare and Medicaid Services. They review these plans to make sure they are fair and broad and give you coverage for things that are commonplace and give you options for common ailments, and then some. So we're just pricing it based on what we know, but the actual formulary is pages long of what's available to you, just what tier it's on, how much you would pay in a copay. Does that help?
Yeah, so chances are just for like an ordinary antibiotic or something unexpected, the choice that we make in the front end is probably still the best choice cost wise.
Yes.
Okay.
Yes. Um, so let's say, all right, you already got this plan and your doctor puts you on what's the amoxicillin? Amoxicillin. Let's see what this would good 180 every month. Okay. Somebody must really be sick. Okay. So done adding drugs. We're going back to where we were. Uh, Plan details. Did it change the plan for me? No, but it's covered. It is I say Walmart. It is a tier 1 drug, so there's no copay on it. Okay.
Okay.
So we price it based on what we know. But there are many, 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 many medications ready for you. Is that good, Penny? Okay. Anybody else?
Tammy,
A question.
Yes.
How
Fran.
do in case you want to change your pharmacy in the new year, if it turns out to be more beneficial than what you're using presently,
Mhm.
um, how do you go about informing the pharmacy of all the drugs that are be coming in?
You call the pharmacy um, that you want to change to, and you tell them you want to transfer your prescriptions from X pharmacy. and they do that internally. I've actually done that once myself.
Okay.
So they will, and I have a CVS portal, and it says, "Do you want to there's a transfer thing. You can actually do it online, but you contact the pharmacy of where you intend to start going and tell them that you want to know their transfer process."
Okay.
Okay.
Thank you.
Uh-huh.
Tammy,
Yeah.
what if you don't get to pick your pharmacy because the patient's in assisted living?
Wow. Okay, there's a good one. Um, then you find out from that assisted living what they use.
Okay, I know that.
Okay. And then uh so I just did one of these recently, and they said choose any drug plan because we use Express Scripts, and they would fill them through that. So what I would say to you is if you're in that situation, which is going to be probably pretty rare among you, call me and I'll tell you my experience with that. And I've actually made calls to the assisted living myself to make sure that it's the right one. Some of them have their own pharmacies, some of them outsource it.
This one's outsourced.
Okay. All right. Well, Cindy, if you want to call me, I will talk to you about it. 'Cause
Okay.
it does vary a little bit from facility to facility. I mean, like Westminster has their own CVS, and other places just do Express Scripts. Others say, uh, just price your meds and then have them all mailed here or mail ordered. So if you'll call me, Cindy, I'll talk you through that based on the situation with that particular assisted living.
Okay.
All right?
Okay. Thank
You're
you.
welcome.
I think we have more control with it.
Anything else?
I've got a question about mail order. I've never used it before. Um, I've been told that you should have an extra 30-day supply of your drugs in case they're late or delayed in sending you your meds. Is that, I mean, what happens if they are delayed? You don't
Via
get your
mail
drugs?
order?
Yeah.
Well, I'm not a fan of mail order because of that reason, delays and relying on the postal service.
Yeah.
Um, I don't know that you can get a lot of these things in advance, a 30-day supply in advance. I've never had that question posed to me before, so I don't know, Fran. I don't know if you can do that or not.
So
I
it's
would,
just better to get it from a pharmacy.
oh yes,
Okay.
absolutely. Uh,
Okay.
yeah.
Thanks.
Uh-huh.
I have a question.
Yes. Hi.
Uh, if you stick with CVS, but the number of the store is different than your number store, do you have to change that to make sure that your drugs are being filled in the right location at the end?
Yeah, that's a good question too. All the if it's a chain, their prices are going to be the same. So if I picked that one, if I it didn't really matter which CVS I picked, their prices are going to be the same. I'm just pricing them. I'm not committing to getting them filled at that particular store. It's
Okay,
not
so
just about, now I am with the apothecary, of course, but as far as the chains go, the price is going to be the same no matter which location.
okay, thank you.
Uh-huh. Wow, you're a great group. So, um, I hope you all found this helpful and it took away the mystique and maybe the trepidation of having to do this yourself. I'm still here for you if you want to call me and say, Tammy, I'm hung up right here. I'm a little confused again. Please call me. You just need to be a little patient on the return call, but I will call you back. So I'm not just leaving you out there totally, but my last session I did, people were quite pleased and said, one lady actually emailed me and said, "Oh, this is great. This looks like a lot of fun." I was like, "Okay." So if there's not anything else,
I have one more question, just real quick.
yes. Uh-huh.
So you have to do this by December the 7th?
Correct.
Okay. And what if you don't want to change anything? Do you have to do anything if you're completely the same?
That's really good. I'm glad you said that because it leads to something else. If you don't do anything, it just rolls over. Okay? It just rolls over. The plan you're on now just rolls after 12/7, the door's shut and it rolls over.
And you
If you
keep what
keep,
you have.
yes, you keep
Okay.
it. If you change plans, you do not cancel your current plan. It's done internally by the Center for Medicaid and Medicare Services because tens of millions of people across the country are changing their plans, probably. And they do the switch within their system. You don't have to call and say, I don't want this plan anymore. It just happens. Good.
Okay.
I'm glad you asked that because I forgot to mention that.
Okay. All right.
All right. One more
So,
thing.
Tammy, one
Yeah.
question. Uh,
Hey, Doris.
Hi.
Hey.
So, so if you do nothing, it rolls over. But what if it rolls over to one of the plans that has exited the system?
Well, it won't roll over. If it's exited the system, then you have a special enrollment and you've got till February the 8th to pick a new plan. That's Anthem or Cigna, right?
Hmm.
We want to do it sooner than later. We want it to start January 1. Um, Meaning what I mean is roll over is your same plan will just renew.
Right.
Right.
But that was my question: is if your plan is pulled out, what does it renew to?
It
But
doesn't.
right. So then you have a little bit longer to choose.
You do, but if you
Okay.
wait past January 1, you won't have coverage until
Ah, right. Good point.
February 1.
Yeah.
So you
Okay.
don't, but you can do it the 15th of December, the 25th of December, whenever you want to do it. That would be a weird way to spend Christmas, um, but you could do that. But
I was just curious. I don't even know if that even applies to me. It, I was curious.
yeah, yeah. That's a good one. That's a good question. Yeah, if your plan is canceled totally, you get a special enrollment to change plans beyond 12/7, but I say the sooner the better. Okay? Well, I hope this was helpful. I'm it's my pleasure to do this for you. I appreciate you all so very much. I feel like I have one of the best jobs a person could ever have. And I thoroughly enjoy. I wish I could spend time with each and every one of you. But y'all have really blessed me in a whole lot of ways, and I pinch myself every morning that I get to do this, and I'm here for you. Give me a call. Um, but otherwise, I think that would end this session, unless there's any other question. Deanne.
I just want to say thank you.
Oh,
And I miss you.
oh, thank you. I miss you too. I was thinking about you yesterday.
Well, I'm going to send you a draft real soon and
Mhm.
to be one of my readers. And I'm still wanting to get the other dental and stuff, but I'll send you a picture of my grandbaby, which will tell you why I've
Okay.
been busy.
That would be great. Thank you, Deanne.
Thank you.
Uh-huh.
Thank you for your help, Tammy.
You're welcome.
Thank you.
Call me if you need me, Fran. All of
Okay,
you.
sure will.
Right. Thank you, guys.
Thank you.
Uh-huh, thank you. All right. Bye-bye.
Okay, she's